Okay, well, let's go ahead and get started. Welcome, everyone. There is a mixed crowd here tonight. Some of you are familiar with the pilot school, others are new faces from outside of the community. So if you don't know me, I'm Allie Williams. I'm the head of school at the pilot school. We're an independent K-8 school for children with language-based learning differences. We have been blessed to have a wonderful professional relationship with our presenter tonight, Dr. Winkelspecht. Dr. Kami is back by very popular demand. Many of you may have attended sessions from last year or over the summer. Dr. Kami has presented on a range of topics, some having to do with parenting, some having to do with understanding our children a little bit more, and that is some of what tonight is about. So I will be lingering in the background. I'm here to kind of monitor the chat and the Q&A. We definitely encourage all of you to take advantage of both of those functions. I know there's some interactive qualities to the presentation tonight as well. We're trying to embrace the idea of a workshop, so you'll have an opportunity to take part. Otherwise, I am going to turn over the evening to the lovely and very expert Dr. Kami Winkelspecht. Go ahead.
I appreciate that. Well, and thank you guys. Thanks, Allie, and thanks, Janet, for also organizing and supporting this. So it's always a great opportunity to be able to work with you guys, but also to be able to kind of present this content to families and parents. So I am excited to do that again tonight. So our topic tonight is anxiety. So I'm going to share my screen, and then we'll go ahead and get going. There are a couple of interactive components tonight. So we're going to try out some poll everywhere. And we will continue to use the Q&A and the chat boxes as well. So as we go through the evening, if you guys have questions, we really want this to be interactive. If we were in a room all together, I love it most when people kind of ask questions and kind of get curious about some of the things that we're talking about. So I want to make sure that we embody that in our webinar too. So that feel free to please put questions in the Q&A or the chat box. And then also, please again, participate in the poll everywhere so that we can kind of get a sense for, how you guys are kind of thinking about some of these topics as well. So today we're going to talk about understanding and managing anxiety across childhood. So our learning goals for tonight, we're going to hopefully understand our kids a little bit better from a mental health perspective. And so understanding the mental health statistics for children. So we'll cover those as that relates to anxiety, but we'll also talk a little bit broadly. So about disruptive behavior and depression, just to give you kind of a snapshot about what the statistics look like for child and adolescent mental health. We'll also work to understand anxiety symptoms and learn ways to differentiate between kind of what's typical anxiety, because some amount of anxiety is normal, and what's clinical anxiety that would really benefit or warrant perhaps a therapy intervention. And so we'll talk through kind of what are symptoms and then what are ways as parents that you can kind of differentiate that and monitor those things. And then we're going to talk a little bit about evidence-based treatment. So I feel like I would not be doing my job well if we didn't talk a lot about what do we know about good anxiety treatment. And so what do we know about that? What do we know about gains for children? And then what are ways that parents can help? Just a few details about the evening. So our purpose is to be educational in nature. So this is not intended to be a substitute for a therapeutic intervention. So if you feel your child would benefit from a therapy intervention after the information that we talked about tonight, if you guys are members of the pilot community, you're welcome to reach out to the team at Pilot and let them know that you need some more resources, or you're welcome to reach out to me, pediatricians. All of these are good resources to help you guys get connected with some of the resources you might find more beneficial. Our focus is really on understanding and supporting kids from a cognitive behavioral therapy perspective. So what we know is that CBT is the gold standard evidence-supported treatment for anxiety. So that's actually across children, adolescents, and adults. So this is really the gold standard treatment overall. And so we're going to deconstruct that a little bit and kind of demystify it, because it's my opinion that we should all kind of think about some of these techniques in everyday life because they're pretty applicable, and we shouldn't necessarily reserve just this information for therapy intervention. So there are a lot of tips in here that you guys can take home that'll hopefully be helpful to kind of coach kids through some situations. The resources that I have at the bottom are a mixture of things that are related to anxiety specifically, as that's our topic tonight, but also we have some about just general kind of like stress and coping, for mental health, the CDC does a nice job of putting together some resources for parents. And so what are ways that you help kids with kind of mental health and stress and coping in general? And then statistics about youth mental health as well. Effectivechildtherapy.org is also an excellent resource aimed at really helping parents to understand what evidence-based treatment looks like for a variety of different conditions. So not necessarily just anxiety, but what's evidence-based treatment for depression look like, or ADHD. And then a couple of these are specific to anxiety. I will put a shout out to the National Social Anxiety Center. So they've done an amazing job of really helping to kind of answer the call, so to speak, of some of the anxiety that we've seen increase related to the pandemic. So the next seminar that we're doing in December is actually a specific kind of subtopic in anxiety, because I think it's been so prevalent and we've seen this need grow so much throughout the pandemic. So for social anxiety, so how do we think about that in the context of friendships, and how do we help kids navigate socially anxious situations? But the National Social Anxiety Center has put out tons of free self-help resources and videos to help you really understand and kind of break down different social situations and ways that you can start approaching those things and feeling more comfortable. So I'll give them a specific shout out. So first, we're going to think about mental health statistics for children. All right, so we have our first poll everywhere here. And so you see at the top that you can go to pollev.com/KamieWinkelspecht974. I know I apologize, Winkelspecht is long, but hopefully you can copy and paste it. We're gonna do 2 of these this evening to get a sense for, kind of what are you guys thinking about some of these factors related to anxiety. So anxiety is the most common mental health condition for children. So in our 5 to 11 age range, is this true or false? What do you guys think? Is anxiety the most common mental health condition for children or not? True. So far, we have a pretty overwhelming 100% true response. And I appreciate you guys typing in the name all the way and getting it in there. The good news is it'll save the link. So the next time you should be able to go in and just respond quickly, or even quicker, let's say. All right, 100% so far. Anybody else that wants to say, no, maybe anxiety is not the most common mental health condition? Any brave souls out there? All right, so we're still sticking at 100, pretty high. Okay, well, I appreciate that. So we're going to look at this. How common are anxiety disorders in childhood? So anxiety is not the most common mental health condition for kids age 5 to 11. So it's certainly common. So it's the second most common, but not the most common. So base rates of child mental health diagnoses, I'm breaking it down here kind of by category. And so 9.4% overall are diagnosed with really kind of like your ADHD, disruptive behavior, things in a behavioral kind of category. So that's the most common in this kind of mid-childhood, so this 5 to 11. About 7.4% were diagnosed with behavioral disorders kind of along with ADHD. So you're going to see this percentage in the graph that we're going to look at in a minute, kind of adding to an overall behavior total. 7.1% were diagnosed with anxiety disorders, and 3.2% of children kind of in this age range were diagnosed with depression. So other notes to kind of think about with this data, so that a lot of these conditions that I'm talking about above are commonly occur together. So it would not be uncommon at all for a child with ADHD to also struggle with anxiety, or for a child with depression to also struggle with anxiety. This is most common actually in children who experience depression. So sometimes this, particularly for younger children, is my experience, clinical experience, that sometimes depression comes secondary to having a high amount of stress or continuing to deal with some of the challenges of ADHD and kind of that frustration. Rates of mental health disorders increase with age. So in general, they increase as we get into adolescence for anxiety and depression. So if we take a quick look here, you'll see these kind of behavior disorders are higher for our younger kind of age range here, and then anxiety and then depression. So once you get to adolescence, anxiety disorders are the most common mental health conditions. So we're 12 to 17-year-olds, a little over 10% of kids are typically diagnosed with anxiety disorders. You also see depression increase pretty substantially during that time period as well, from your 6 to 11-year-olds. So looking at this data and thinking about how common some of these mental health conditions are, I also like to highlight how many children receive treatment. And so what we know, again, the CDC does a great job of tracking all of this information for us to get good overall data about kids and their mental health. This data was collected, I should also say, in kind of 2020, in June of 2020. So we don't have a great snapshot, at least at this point, about what that really looks like for kids kind of at this point in the pandemic. We certainly know that anxiety has increased. We know that depression has increased. Behavioral challenges have also been, more common in a variety of different age ranges. But it's been hard for us to get a good sense of what that data actually looks like. One of the reasons is because a lot of this data is captured sometimes for kids in school, and with all the variability in the school year, it's difficult to kind of get a sense of that information day to day. So the kids who receive mental health diagnoses, 8 out of 10 who are diagnosed with depression receive treatment. So that's the highest percentage. 6 out of 10 children who are diagnosed with anxiety disorders receive treatment. And about 50%, so 5 out of 10 who had a behavioral condition receive treatment for that condition. So what do we take away from some of this data? What does this really tell us about our kids? So a couple of things. I think it can certainly be hard to identify signs and symptoms of mental health disorders. What we know from talking to kind of kids and parents and from looking at the data from both of those perspectives, which is one of my favorite things about being a child psychologist, is that I really get to look at both of those unique perspectives and kind of what does that tell us about kids and their experience, is that kids are often better reporters about anxiety and depression. So those things that are kind of internal to them. So those things that are more a little bit in the eye of the beholder in the situation, so to speak. So kids are better reporters about their internal kind of mood and anxiety state. Parents are better reporters about behavior and the things that you're kind of seeing in the behavioral disorders. Kids are not necessarily as good at reporters about their disruptive behavior, but it can be hard to identify some of these signs and symptoms. It's also hard to know when to seek treatment. And so when is something let's say, big enough problem, kind of quote unquote, or when would it warrant kind of a clinical intervention, and how should we think about that? Access to treatment can also be really challenging. So we know that barriers to care are substantial. We know that mental health providers are actually more kind of busy and at capacity than ever before in terms of the pandemic, because it's really created a lot of challenges for mental health for adults and kids and teens. What does this also tell us? That workshops like this are really important, because we're going to talk about some of these things today. So we're going to talk about how do we identify some of those signs and symptoms, and how do you as a parent know where that line is? When is it helpful to think about treatment? And when are some of these things able to be kind of coached and resolved pretty effectively at home? And so hopefully we'll leave with some tips and tools for you guys to navigate that a little bit better. So understanding anxiety, or when to worry about worry. So we're going to cover both of these things next year. And so I'll just pause really quickly and see if there are any questions so far about any of the material or kind of surprises with the data that we've talked about so far. Okay. All right, so let's learn a little bit more. All right, so our next poll everywhere, anxiety is always harmful, true or false? Is anxiety inherently harmful to us? False. Another really clear, decisive response. So 100%, right? Anxiety is always harmful is false. So there might be some value, right, to anxiety at times. All right, thank you guys for responding. I appreciate that. So you're right. So is anxiety always harmful? It's not. What we know is that moderate fear and anxiety can be appropriate and adaptive across many different situations. Anxiety, so even in anxiety treatment, so we can reduce the kind of excessive anxiety, we can reduce like the impairment from anxiety. I would never say as a provider that you can eliminate being anxious entirely, because that fight or flight response that we have physiologically in response to kind of danger or stressors, those types of things, is a very biologic mechanism. So what happens, right, when you have an anxiety disorder, or you're really excessively worried, is that that system is kind of overactive, right? So it's saying that there's danger and sensing danger in many different situations where danger is not necessarily close or it's appropriate to be that worried. But we would never be able to eliminate all of anxiety responses, because it does help us, right, in some situations for sure. So being anxious when you start a new activity is what most kids would probably say before they kind of try out for a sport, let's say, or before they start a new school year, or before they decide to, kind of join a new club at school. So being anxious when you start those activities makes sense, because you just don't necessarily have a way to think about those. And you're kind of wondering and kind of a little worried about what that experience is going to look like. Being anxious before a test or a quiz, Some might argue that that actually helps you to be a little bit more prepared for it. So being anxious before tests or quizzes can help us, right, to be a little bit more prepared, a little bit more focused on studying, and that could help our performance on certain tests. Being anxious before you have a sleepover for the first time, I highlight this one for kind of our, age group for thinking about this 5 to kind of 11, right, 12-year-old age range, because kids have different responses to that throughout that time period. And also, I think that is something that has been quite like increasingly more challenging in the pandemic. So as we get less practice at going over to people's houses or less opportunities to do these things outside of our house, the fear and the stress about some of these situations certainly grows. Being nervous before doctor's visits. So I certainly think that that's one that many kids experience. Interestingly, right, most kids would also say they're pretty nervous about shots. I've had kids say that they were actually excited for getting COVID shots. So I think kids were driving kind of that excitement about getting those shots so that they could kind of get out there and feel like they were more comfortable and kind of safe doing activities. It's probably the only time that I've been a psychologist and had kids excited about a shot experience. So some fear about that situation is certainly very typical. So these are the most common symptoms of anxiety. And so looking at this list overall, we see a lot of physiologic symptoms. We also see a lot of kind of thinking symptoms. And then you're also going to see symptoms and kind of changes in behavior, kind of loss of interest. Those are usually the 3 categories that anxiety symptoms kind of collect themselves in. What happens most commonly for younger kids, and this is really your kind of 5 to 8-year-olds in particular, is you're going to see a lot more physical complaints. And so younger kids are not necessarily as aware of kind of their emotions, and they're not necessarily as aware about why kind of they might be stressed or worried in a situation, but they just feel really uncomfortable and oftentimes feel really sick in those situations. So you get a lot of physical complaints in that younger kid age range, also as, preschoolers. But frequent headaches, stomach aches, body pains, being easily fatigued, panic symptoms fit into that category too. So panic attacks are certainly a part of anxiety, but they can occur outside of the context of an anxiety disorder as well. But having your heart racing, feeling flushed in the face, increases in body temperature, and really rapid breathing. Oftentimes panic attacks result sometimes in emergency room visits when they happen for the first time, or in situations where you're not necessarily able to identify a stressor or a trigger, because they do create such a strong physiologic response in a lot of children and adults. And so sometimes it's helpful to have that medical checkup to say, so we think all those systems are okay, this might be more related to anxiety. School nurses would tell you that these physical complaints and kind of panic symptoms are also frequently what result in trips to their office as well. Difficulty concentrating, we've got some cognitive symptoms next. So difficulty concentrating is a symptom of actually across all 3 main categories of childhood, mental health diagnoses. So it's a symptom of attention deficit disorder, it's a symptom of anxiety, it's also a symptom of depression. And so we have to really kind of be careful and sort through where is kind of that difficulty concentrating originating from. Persistent questioning about situations. So this is a behavior that we can see, but it relates to this cognitive part of worrying. And so when kids are asking lots of questions about situations, so when are we going to do this? Who's going to be there? What's going to be happening next? What's going to happen if our schedule changes? What's going to happen tomorrow? Who's going to pick me up from school? Lots of persistent questions like that can give us a clue that there's something else kind of cognitively that's going on. There's another worry, or there's a reason that your child is kind of feeling uncomfortable or unsettled about a particular situation. Excessive restlessness and fidgeting, there's a lot of behavioral parts of this too. So that's also, right, a trait of ADHD. So we have to be careful when kind of sort through, is it anxiety or is this attention? And make sure that we're really doing our due diligence to understand kind of what's underlying that behavior. Changes in behavior and interest. So in younger kids in particular, and then you also see this kind of peak again in adolescence, you see a lot more arguments, increased tantrums, kind of like a really high response to a situation that would not be necessarily very stressful or anxiety provoking. Refusal to do certain things, avoidance of certain situations because they really are hoping for that discomfort or that anxiety to go away. Loss of interest in activities. So all of a sudden, right, kids who really enjoyed participating, let's say in, Girl Scouts or Boy Scouts, have no interest in participating in that activity anymore. So is that because they're just not interested in some of those, things that you would do as a part of that group? Or is it they're too nervous to kind of join or kind of rejoin that activity as we're thinking about that at this point in the pandemic? You see a lot of crying and trembling, particularly in younger kids, because they're not quite sure how to express some of these other things or to ask the questions that help reflect what that worry is. These increased in tension, kind of stress, irritability, that's what really relates to a lot of the arguments. And so as kids get more stressed, their kind of threshold for being able to tolerate, certain kind of changes to their day-to-day activities or requests from parents, their tolerance for that changes. And so you see more of that again, kind of tension, irritability, and then anger outbursts. I have avoidance on here. I should put avoidance on here twice. So what happens most times when kids are really nervous and anxious is they try and avoid the situation that makes them anxious. Adults do this as well because it makes you feel better, right? So it makes sense to me, right, that we would want to avoid situations that would make us anxious, because when you do avoid them, it does actually get better, right? The challenge is it gets better for a short time. It doesn't actually resolve your ability to get into that situation, kind of get back into the mix, so to speak. And so it kind of unwittingly, right, kind of undermines being able to overcome the anxiety and really to learn to kind of manage those situations a little bit more effectively. So we'll talk about a few developmental differences here. So children age 3 to 8, and I started to highlight that a little bit when we were talking about symptoms. So in this younger child age range, you certainly see much more focus on the physical symptoms, that they feel sick, they don't feel right, they feel hot, they feel uncomfortable. They're not quite sure what's going on, but you see a lot more of that stomach ache, headache, kind of tiredness, those types of things. They have less ability to talk openly about their feelings. So they might feel uncomfortable, but they're not quite sure, right? Is the word anxiety? Is it worry? Is it stress? We use a lot of different words to actually describe kind of the concept of anxiety. There's no magical way to think about it, but a lot of kids think that they're kind of like uncomfortable or they're not quite sure how to feel, because it's not necessarily one of those feeling words that we talk about, first with kids, right? We're thinking about happy, sad, mad. We're not necessarily thinking about this concept of anxiety. So it takes a little bit more time sometimes for kids to develop that language. Younger kids, no matter how bright the kid is, so you could be, right, the brightest kid IQ-wise, you really can't think about your own thinking. This idea of metacognition, you really can't think about your thinking in a way that changes it until you're a little bit older. So this is why oftentimes questions that parents are asking when kids are really nervous, you're avoiding, it's like, why do you feel like that? Why is this uncomfortable? Why is that happening? And kids really don't know the answer to those questions oftentimes, because they know that they're uncomfortable. They know the situation makes them uncomfortable, but they can't quite get to that other level of processing yet. And that's just a matter of like brain maturation and development. You can't think about your own thinking in a way that changes it until you're about 10 plus. Somewhere between kind of 8 and 10, the skill starts to emerge. And then kids are able to better articulate, right? What are these worries? What are the things that make them uncomfortable? And then why, right, that might make them really uncomfortable? What are they really worried about in the situation? But younger kids are a little bit more concrete. That actually makes it sometimes easier to change from a treatment perspective, because it's not necessarily very complex in many ways. It's kind of uncomfortable, and we have to help you feel a little bit more comfortable in that situation. So insight-oriented strategy. So if I can't really think about my own thinking and I don't have a very cognitive kind of part of worry that develops for younger kids, then insight-oriented strategies are not necessarily very effective. So spending a good amount of time trying to figure out like why they're worried or what about the situation is making it uncomfortable doesn't necessarily result in as much change with this age range. So all intervention actually for younger kids like this is just as effective if you were parent coaching it. So sometimes kids this young would not have to participate in anxiety treatment at all for those behaviors to change. And that research has been growing pretty substantially in the last 5 to 10 years. So researchers have really been looking at what kind of can parents do to support this, and particularly for younger kids. And is parent or is child participation necessary if they don't necessarily have some of the ability to think about this? How can we help parents to help kids to develop that language and then to just manage through those situations really effectively? And the good news is that we've been able to develop interventions that are entirely parent only, that are effective for kids in this younger age range. Kids 10 plus have physical symptoms, but they usually understand that they're related to anxiety in some way, or related to kind of being uncomfortable about something. And they can talk about that a little bit more in a complex way. Lots more talk about feelings and stress. So a lot of times kids say that they're stressed. That's kind of a catch-all, I feel like, for things that might be kind of anxiety related. And so kids will talk about that concept of stress and what are the things that would kind of stress them out on a day-to-day basis. Metacognition develops, so kids can start to think about their own thinking and be helpful to change it. They can understand and kind of better rationalize about why a fear might be excessive. Why is this fear not something that makes sense based on kind of the data that we know? If I think about social anxiety. So if you're in a lot of social situations every day, and you're usually doing pretty well, and it's the smaller right portion of the time that you might have a challenge, kids can really start to kind of think about that from a data and a logic perspective when they're a little bit older. So they can say, okay, most of the time I'm pretty successful. It's only a couple of times that I'm not very successful in this situation. And then that really helps us to change it and help them to develop a little bit better insight into that. So as a parent, when should you worry about worry? So again, everybody feels a certain amount of worry at times, and they might worry excessively for a brief period of time. So you could worry excessively for a few days or even a couple of weeks, and that not necessarily be problematic. And so what I really want to encourage you guys to kind of think about, and I really coach parents to think about, is to focus on this idea of impairment. So what is the anxiety creating? What is it preventing you from doing that you would really like to be able to do, or that you need to be able to do, or that your family would really need to be able to do? And the anxiety is really preventing you. So it's where it kind of goes from it's creating a lot of stress or kind of like challenges in the short term to it's really impairing us from like meeting our day-to-day routines or meeting kind of academic success, goals, those types of things. And that's really the differentiator between clinical anxiety and what's pretty typical. Thankfully, we know that most kids are actually resilient. So most kids, by and large, when they encounter a stressor, in about 3 to 4 weeks, they're going to be able to kind of go back down to kind of their usual kind of like post-stressor, routine, so that they won't, even if you saw stress for a brief period of time, you won't continue to see some of those same patterns. But again, if you continue to see that, here are the things that you want to think about to help you get a better idea about whether it may be helpful to seek an intervention. So is it preventing success? And where is it preventing success? So is it preventing success at school, at home, with other kids in kind of social situations, kind of in and out of school? Is it causing health difficulties? So a lot of times the big two are stomach issues and sleep trouble. So is it creating challenges going to sleep, or is it creating challenges with kind of stomach headaches, those types of things? Oftentimes, anxiety for kids is greater at night. And the reason for that makes a lot of functional sense to me. So all day, particularly younger kids can kind of distract themselves throughout the day. So if you're at school, if you're in aftercare, if you're in a sport or another, club activity, you're pretty busy for most of the day. And you don't necessarily have a time to kind of catch up and start to kind of think about your worries or think about what the day was like. But at night, you're supposed to kind of slow down, kind of like shut down the things that you're doing and kind of be on your own. And, for kids that worry, you're kind of on your own with your thoughts. And so that you start to then kind of rethink about situations, or worry can kind of catch up with you and be a little bit more problematic at that time period. And so challenges in sleep are something that you, see for anxious kids a lot. Is your child not achieving to their potential due to worry? So is the worry and stress preventing them from being successful in kind of test situations? Is it preventing them from being successful like day-to-day and kind of homework completion? Time tests are something that worry a lot of kids. And so when you start to kind of take time tests as kids are starting to master like multiplication facts or those types of things, it can create a lot of worry because kids know that they have to perform in a certain period of time. That's usually one of the first times that kids start to become really stressed about kind of time. Is your child avoiding situations that create difficulty for them or the family? So are you not able to go to family gatherings? Or you're not able to go to, let's say the grocery store? You're not able to go to certain places because your child is so stressed about going that you have to kind of avoid it entirely. This one I think is a big one for parents. So how much time, if you really kind of think back on your day and think back on your week in a quiet moment, hopefully, there are quiet moments out there for us as parents, but how much time do you think about as a parent managing your child's worry? How much time do you spend navigating around this or making an accommodation to where something is a little bit less stressful, or answering questions about worry, or helping them to calm down before sleeping? So how are you managing around it? It's this idea of accommodation. So what are we doing that's creating a lot of workarounds in our day-to-day schedule because of the fact that the child is anxious, because you're nervous about this, and about this situation? Then we have to kind of go about things in our day-to-day routine a little bit differently. And so if you kind of look at the day as a total and you think about what's the amount of time that you're spending doing this, sometimes that can be a real indicator for how anxious the kids might be. And then who's really in control? So is your child in control of making this decision? Did your child say, no, I don't really want to try out for the basketball team? Or is it the anxiety that's saying, you're not going to be successful, right? Don't try, right? You're not going to make it. You're not going to be successful. And so don't even try, avoid that activity. And so who's making those decisions can really help you to get a better sense of who's in control. So if the anxiety is kind of in control in that situation, I always say we don't really want anxiety making important decisions. So I don't want important decisions to be made because you're nervous or uncomfortable in that situation. So if you're truly not interested in a different activity more, that's totally fine. But we need to figure out how do we kind of understand that a little bit better so that the anxiety is not controlling and starting to limit the world and kind of make it smaller and smaller. And I think that can be a helpful concept for kids to kind of think about too. This is also concrete enough that if you ask kind of your child, would you like to do this, right? If you weren't necessarily nervous, would you like to be able to participate in this activity? You know, are you kind of making that a decision, or do you think you're kind of worried about it and that's what's making the decision, right? Even kind of younger, right, children can start to understand that concept. So common anxious situations for kids, all these things that are on this list are things that a lot of kids would be nervous about. And again, we want to think about this in the context of that idea of impairment to really determine if it's a bigger problem or more challenging situation. Start of kindergarten. I've probably done the most TV interviews actually related to the start of kindergarten. And that's actually as much for kids and how to prepare kids as it is actually for us as parents as well, because kids starting kindergarten is a really important and kind of stressful milestone for parents as well. Testing situations, starting in a new school or a new school year, particularly as I think about some of these things and we think about the impact of COVID, starting kind of school this year, I think has presented many challenges. I know at Pilot, you were fortunate enough to be in the school building all last school year. But again, we did things really differently. So recess was very different and kind of limited. The amount of times that you transition classrooms, if at all, was very limited. The amount of kids that you encountered who were new or in different groups was very limited. The amount, again, that you could even, play with different play equipment or those types of things was really different. So I feel like starting this school year has been a real readjustment to some of these things. Again, we're still wearing masks, but I think kids overall have accommodated to that a little bit better overall. But I think this year kind of being back, we were all looking forward to, having a more kind of typical kind of school experience, so to speak. And I think it's come with some new challenges as we start to navigate some of these more, what would have been readily occurring situations, but we didn't have them for about 18 months in the same way. And so I think kids have really started to, we've really started to understand, I think, some of the social impact and some of the kind of challenges that that's placed on kids kind of in terms of skill development. After getting in trouble, a lot of kids feel nervous about that. Before or after report cards. So as you're getting kind of grades, you're getting progress reports, this is kind of the time of the year for that. And so you sometimes see stress kind of go up and kind of decrease after that pretty predictably. Making new friends, sleepovers, I still keep that on there because I think sometimes, everybody's still navigating, how they feel about that in a pandemic world. Learning new skills, participating in activities, flying on planes is anxiety provoking for sure for many people. I put bugs and weather fears on here for us. So we see that typically in younger children more than we would see that for the first time in teenagers or adolescents. And we also only see these two things most of the time in the summer. I almost never treat a bug phobia in the winter because the bugs are not around and bothering us anymore. Same with weather, We like snowstorms. We don't necessarily like thunderstorms, or the fear of tornadoes. And so those are usually pretty season specific. A lot of kids get nervous about school assemblies, plays, concerts, presentations, those types of things. And again, what you're thinking about, these are all very common situations that we learn to kind of navigate and get practice with and feel better about. So that feeling nervous before them and then kind of getting through them, we can help kids to see how successful that they were, which helps us to kind of reduce that anxiety. If you're also not seeing that anxiety reduce in these situations, so you're learning kind of a new skill or you're in kind of a recess situation that's kind of stressful in an ongoing way, and you're not necessarily adapting or accommodating to some of those things, then those are some of the signs too, that anxiety might be getting a little bit too much. So common anxiety disorders. So if we're thinking about kind of diagnostic categories of anxiety, generalized anxiety is usually the most common. I think generalized anxiety gets kind of a little bit of a bad rap, so to speak, diagnostically, but basically it means that you're excessively worrying in several different categories. So you might be worried about academics, social situations, and weather, so to speak, So you might worry about more than one category of things. And all of those things kind of have the same pattern of excessive worry. Separation anxiety is exclusively related to times that the child is separated from a parent. And as kids get older, they have a more complex sense of what kind of the dangers are that could happen, right? So older kids who have separation anxiety, sometimes you'll see three peaks of this. So you'll see your kind of preschool, kind of kindergarten kids who are separated for sometimes the first time from parents, just kind of being physically separated and not sure about what that school situation is going to look like. And that they just feel uncomfortable kind of being away from their parent because they like you guys, right? They enjoy being at home and their parents help bring them comfort. When you get to middle childhood, you might see a second peak of separation anxiety for some kids because you really start to understand kind of what could happen in the world when you are not with your parent. So kids start to worry a little bit more, again, along with some of that cognitive development that we talked about earlier, that they start to worry a little bit more about what could happen when I'm not with my parents. So something could happen to them, something could happen to me, some kind of harm could become like a problem for my caregiver. And so you get a little bit more of that complicated cognitive worry and separation anxiety for slightly older kids. We might argue actually that homesickness for kids that are going to college for the first time could also be part of separation anxiety. I might make that argument because they're doing a lot of things away from you guys that they would have not really had any experience doing before. And typically it kind of goes down in that same kind of 4 to 6 week time period. Social anxiety, this is anxiety that's exclusively related to kind of social situations. It could be a variety of social situations, but it's also anchored in the idea that you're worried about what other people's perceptions are of you in that situation. So what are other people thinking about you? What are they looking at what you're doing? Do they have a negative perception or evaluation of you? Our next anxiety topic in December is all going to focus on kind of social anxiety and friendship. So I won't talk about too many examples of that this evening. Obsessive compulsive disorder. So this is a specific anxiety disorder where we have a really focused kind of worry or fear. Oftentimes that could be about something about safety or germs. And you develop kind of behaviors, right, to help you kind of reduce that worry. So you might have an obsessive worry about making sure that your house is safe. And so you develop a behavior where you check the doors and windows a certain number of times. Now, it might be very typical to check the door, right, as you're a child at home and you are, at home on your own, and you're going to check to make sure the doors are locked once. But if you do that a second time and a third time and a fourth time, that becomes compulsive, right? So if you're also doing that across different categories, so a lot of people have actually little obsessive things, kind of obsessive or compulsive traits. What's anchored really and kind of we think about when we think about it coming to the level of a disorder is how much time is it taking you to do these things, and is it preventing you from actually engaging in day-to-day life? So to have a diagnosis of obsessive compulsive disorder, you have to be spending more than an hour kind of engaging in these obsessive and compulsive rituals and routines. So that hour criteria. Younger kids also are not required to have insight into that. So children and teens, the criteria is kind of different between adults and kids, so that you wouldn't necessarily know that those things are excessive as a child. Specific phobias, we talked about a couple, right? So bugs and weather on there, kind of blood injury injection, like so shots and getting your blood drawn is kind of another one, right? Related to kind of like needles, and specifically that happens a lot in kids with medical conditions. And then you also have panic disorder. So this is, you could have this with or without agoraphobia. Again, most kids don't have panic disorder with agoraphobia because they are not in their house and staying in their house for much of the time. Kids don't necessarily have the ability to limit their world in that way, right? They're at least kind of going out and going to school. But panic disorder is really characterized by having panic attacks and that they're occurring frequently, and there's a lot of worry associated with those. All right, so I'll pause here to see if there are any questions so far about any of the information that we talked about. So any questions about any of the symptoms or kind of differentiating that we've talked about so far? No? Okay, please don't be shy about asking a question. So if you have something in there and you joined for a particular reason and we haven't necessarily gotten there yet, make sure that you ask a question if you would like to. All right, so let's move into thinking about effective treatment. So what's effective treatment look like for childhood anxiety? So we talked a little bit about at the beginning, kind of what cognitive behavioral therapy is. So it's a gold standard treatment, kind of this first line treatment for anxiety disorders. There's a lot of strong evidence that would support that CBT is a first line treatment doesn't have the same risks, obviously, that some medications do. And so like starting with kind of a therapy episode and kind of doing cognitive behavioral therapy specifically is a really good place to start for most kids and families when you're like starting an anxiety treatment or kind of understanding whether an anxiety disorder is present. Sometimes it's not necessarily possible to do right treatment alone, and that could happen for a variety of reasons. So most commonly that would be if the physiologic kind of distress. So if your panic or stress in situations is so high that it's really preventing you from doing a lot of things in daily living, or that you can't necessarily tolerate starting to do what we'll talk about in a minute, kind of exposure. So starting to kind of approach situations and kind of get through them. Then it might be that a medication intervention is really warranted to help kind of bring some of that stress down before you could really participate as effectively in treatment. Most of the time we find that CBT, when combined with medication, is the most effective outcome. So in kids that need medication, then having a combination of medication as well as cognitive behavioral therapy is the most effective. So again, that treatment with kind of an SSRI is a viable choice for kids who are unable to tolerate, right, or engage in CBT. And that could be for a variety of reasons, or don't necessarily show improvement. And so I always talk to parents about this idea of response to intervention. So if the intervention is the right fit, kind of at the right time, and we're getting some traction and starting to see some progress, then we're going to see that probably in about 4 to 6 weeks. So that change can actually occur fairly quickly. It's not something that takes months and months to start to see progress. So a good cognitive behavioral intervention for kids, you should start to be able to see some of those changes in as little, right, as a couple of weeks, 4 weeks, 6 weeks. You should start kind of moving in the right direction. So better understanding it and then kind of taking steps to manage it a little bit more effectively. So if that's not necessarily happening, then we kind of talk a little bit about what's the reason that the response to intervention might be a little bit slower or not as robust as we would have hoped. And then one of those right recommendations might be kind of medication at some point in time. So what is cognitive behavioral therapy? I've talked about it a couple of times, but I want you guys to kind of really know what this looks like so that if you are kind of thinking about, right, needing an intervention or you're engaged in intervention, I want you guys to have good tools to know whether you're getting kind of the evidence-based standard or not. So the process of CBT is really with this underlying idea that your thoughts, feelings, and behaviors are all connected together. So they're kind of connected in this triangle, and I always explain that in that way to kids. What we know most is we can really tell our kind of feelings most of the time. And so most kids can give me a list of feelings that they know, and then I can identify how they feel in different situations. So that's usually the most readily available kind of cue or information that kids have. The second most common, right, is behavior. So it's what you do or what you see or what other people see you do in those situations. And so parents are really good reporters of kind of what that behavior is oftentimes. And again, it's where kids and parents partner together really nicely because sometimes kids might not be aware of all of the things or behavioral challenges that are kind of coming as a result of anxiety. But kids, again, are usually pretty good reporters about what happened in this situation. So what did you do once you felt anxious or once you felt nervous? Well, we're not necessarily as good at identifying as these thoughts. And so we know that thoughts in anxious situations are usually related to some kind of danger or overestimation of like a negative outcome or some kind of dangerous situation. Again, for younger kids, those 3 to 8 year olds, there might not necessarily be a more complex kind of cognitive thought. It could be, this is scary, I don't like it, and that's it. And it could be that straightforward and not necessarily as complicated. So don't assume that that thought part is really there or complicated for younger kids. For older kids, there's usually a thought or a fear, like a core fear or a worry that's anchoring that situation. And so what CBT really helps parents and kids to do related to anxiety is identify what's this fear and worry and stress, or what is stressing you out? What's the worst thing that would happen in this situation? So if you join this new activity, what's the worst thing that could possibly happen? And it might be, I wouldn't like it, or that the kids wouldn't talk to me. Like there's usually something that's kind of a core fear or worry that's creating this feeling, and then subsequently that behavior. So identifying these emotions and physical signals that the fear is sending really helps us to start thinking about as clues. I talk to kids a lot about it being a detective. And so what feelings are a big clue, right, that our anxiety is kind of giving us that something's coming up, right, or that we're really worried, that we're nervous. That's a clue that something's starting to kind of be off in that situation. So we should be paying attention to it. It helps us to then identify what that action or fear that the behavior is causing. So what is this fear? When I feel those signals or see those signs, what am I more likely to do, or what am I less likely to do? Kids can start to think about that relationship. And again, with older kids, then we help them to really think about like, what is that core fear and how do they identify that? So once you have that thought, like, oh, I'm not going to be successful, or I'm going to fail this test, it causes you to feel that anxious feeling and have that stomach ache, and it causes you to go to the nurse's office and avoid it. Then we want you to try something different. So how do we help to disrupt this cycle, and how do we help to kind of reset that thought? So we know that, again, kids are more successful than they're not in a variety of situations, and that this anxiety is just causing them to over-focus on that negative outcome. So what we need them to do is to start to approach these situations and really kind of face the fear and see that that outcome isn't likely to happen. What we know is that just talking about it, so the more that we talk about how this fear isn't necessarily very realistic, or that this fear doesn't happen, or that all the evidence that we have about you as a kid tells us that you're more successful than you realize. We could talk about this all day, but if you didn't do something different or try something different to kind of approach that fear or be in that situation, it wouldn't really start to kind of have that change, because you need to experience kind of for yourself that that feared outcome isn't really going to happen, or very likely. And there's not, on some level, the amount of talking about it that's really going to do the work of kind of getting out there and trying it. Therapy is not CBT unless you do something new and face the fear. So you have to do something different than what you're doing now, and kind of understanding this cycle to help you start to kind of approach the fear and to break it down. So it must include what are called exposure. So this idea of putting you in a situation that makes you a little bit nervous, and you do that in a smart and kind of calculated way, right? You don't do that in a way where, if you're afraid of flying, that you just get on a plane and try it. That is actually how a lot of people overcome flying fears, because at some point in life they have to do that. But it's not ideal, and we certainly don't want kids to necessarily be in that experience. So we think about ways that you can break this down and start to really kind of approach this fear and show yourself, right? Bravery activities, I usually call them. So with younger kids, we think about ways that you can start to be brave and kind of test out how well that you might do in this situation, and how, right, you're braver than your fear is, and that we're going to work to get these worries to kind of go away to a faraway land, right, where they don't bother us anymore. Less thinking for younger kids, and you really want to focus on reward. So what helps kids to want to do things that are going to be difficult or a little bit stressful is that we're going to give them a reward for being brave and trying something new and different. And that can help give them that little push. Again, that's not because we want them to be rewarded for all these things, right, that are brave at that same level forever, but it gives them a little bit of a push to start to try to do something that's different or hard, or makes them a little nervous, to get that experience that we know is going to be really helpful for helping them to reduce that anxiety. So we said, again, we talked a little bit about anxiety overestimates this danger. It makes it seem like this fear will become true. So I talk to kids a lot about how it tricks you. So the anxiety kind of monster, the worry monster, kind of tricks you into thinking that all of this danger is there, when that's really not the case in most situations, and that we can try and prove that this worry monster is wrong, basically. So if we think about kind of test anxiety, right? So most kids, right, might think, I'm going to fail, I'm going to do poorly on the test. They would get a stomach ache, feel sweaty, go to the nurse's office, avoid taking the test, essentially. What we know is you can't avoid taking these tests forever. So eventually, your child's going to have to go back into a situation, and we're going to talk a little bit about how, right, okay, so you have to take this test. We can't avoid it forever. And what do we know, though, about how successful that you usually are in these things? That you go in, you kind of focus your best, and you do pretty well. Pretty well isn't perfect, but you do pretty well in that situation. And so when you go in the next day, then you start to coach yourself to say, okay, I'm going to be more successful. I can get through this. I can stay calm, and then I'm going to do better. You have less of that stomach ache, and you have less of that avoidance. Spiders, so let's take a bug example. You might feel really panicked and stressed, right? Because that danger is high. You might see a spider and think 100% that's a brown recluse. I know that it's going to kill me for sure. It's going to bite me. I will die in 3 to 7 days, because lots of kids with bug fears research the facts on this. And they're in 3 to 7 days, I'm going to develop a rash and I will die. Okay. Well, how do we know for sure that every spider that we see, how likely is it that brown recluses are kind of the most common spider that you see in your house? Obviously, kids run away and avoid this situation, but we can start to help them see that these spiders are actually not very common. And in some regions, right, aren't present at all, right? So some of the things that are the most dangerous often aren't present in the region where you are. So we can start to help them be a little bit more logical in understanding what the realistic picture of danger. Sure, there are brown recluses out there, absolutely. Are they dangerous and we don't want them to bite us? Sure, but it's not likely that spider that you're seeing in the corner of your room is at all a brown recluse, based on what we know about the spiders native to Delaware. So what we also know really helps kids in this situation, you'll see it throughout as we're talking about this, the role of parents is really huge when we're focusing on anxiety for kids, because parents are the ones who are seeing this most of the time. It's really distressing to see your child overwhelmed or panicked or having difficulty in a situation. And what happens as parents is we want to make it better. We want to figure out ways that we can make it better. And our instinct oftentimes in that situation is to kind of accommodate or work around or maybe avoid that situation. And that's a really natural response to situations when children are really anxious. And again, that might happen and it might not create a problem. But if it starts to create more of those impairments and challenges, then we want to think about how we really help kids to kind of face your fears, so that we need to really kind of get in the habit of helping them figure out, how are you brave? How can we help you to see that you can do more of these things and you're really believing that we want you to get confidence and we want you to increase your bravery, that you can be strong and manage a lot of different situations. So we want to help kids to break these fears down and then into kind of manageable parts, basically, and then help them try to take steps to approach them and be successful. So what can you do to try and kind of make a new friend? Wow, so saying like that you're going to talk to 5 people each day feels a little bit overwhelming. But who do you think, might be somebody that you'd like to kind of start a conversation with or say hi to? Or who do you sit by, at lunchtime that might be fun to kind of say hi or talk to? And so you figure out how to break down some of these situations into small parts and then set a really specific goal and say, hey, do you think you could say hi, right, to Sarah tomorrow or something like that? And see what she says, right? Do you think you could try that out? Well, sure, I could probably try that out. All right, so let's have you do that tomorrow, and I'm going to check in with you and see how it goes. Let's see how brave that you can really be in that situation and what happens. So you break this down in ways that kids find it tangible and to decrease the amount of stress so that they can start to kind of approach them. Also thinking about ways and times where kids were successful. So oftentimes when you start to kind of break down some of these bigger fears, then you can relate it to a situation where they might have been really successful. One of the things that helps younger kids in particular, and older kids too to a certain extent, overcome fear is having a really high motivator, right? So sometimes kids will be really motivated to be a little bit more outgoing and kind of test things at, like, let's say a birthday party. And I'm thinking about this kind of pre-COVID because I feel like we don't have as many birthday parties now, unfortunately. But like they might be really brave to try a new activity or like a new kind of bounce house or like something like that because it looks cool and everyone else is doing it in that situation. So the more that you can relate the thing that they're nervous about to something that they've been pretty successful doing, it helps them to see this other task as really approachable as well. The good news is this gets easier every time. And so kids, as they start taking these small steps, and again, we're kind of focusing on that process versus the outcome, right? They're not going to be anxious today and then make a new friend tomorrow necessarily if they're not really in the habit of talking to kids. So we're going to have to get them started and kind of comfortable with that. But it gets easier every single time that you do it because the likelihood of success in these situations is pretty high. You're going to pick good goals. You're going to be smart about how you're breaking it down and help them see that they can be more successful each time. The other thing that's really important at the end, so let's say that you set that goal with your child about saying hi today, you always want to make sure to check in and see how it went, so that you are remembering the goal and that you're checking in to see how successful they were, or if it was hard, right? And they kind of got a little bit stuck. And I call this connecting the loop. So we want to connect back to, so once they have this success experience, let's say that the child said hi or invited them to play with them, we want to connect that back to the fear so that you were worried that she might say no, or that she might not want to play. And here's what you really found in the situation. So what does that tell us about when you say hi to people? What usually happens or what's likely to happen? Okay, well, people might invite you to play a little bit more, or it might go a little bit better than you thought. So we want to kind of take that experience and connect it back to the worry so that the child sees that that fear is not as likely to happen. So they get credit for all of this hard work that they're putting in. Providing rewards for bravery and taking on these difficult tasks is really important. So it's hard work. When you're feeling really uncomfortable about something, it's hard to think about how am I going to start doing this or what's going to happen right in this situation. And again, that reward just helps you to provide that bridge and a little bit of extra motivation to take a risk and take a chance because we think it's going to work out for you pretty successfully. We can also use rating scales to communicate kids about fear. So as you're starting to try and break things down into smaller parts, I always talk to parents a little bit about this idea of a scaling question. So you want to rate things. So I usually use just a 10-point scale, but for kids who are kind of 3 to 8, sometimes I'll just use like a stoplight. So you've got red, yellow, and green. And so you want to ask them about these different situations and say, how nervous would you be about asking, saying hi to a friend? How nervous would you be to ask them to play with you? How nervous would you be to ask them to play and join their game? And these all might have different levels, right? 1 to 10, and they all might have different ratings. So the difference between kind of that stoplight system and then kind of a number system is that kids really have to have a concept of kind of bigger and smaller numbers. And so you can't really use a number system until kids kind of get into elementary school. You really have to use more of kind of a stoplight system for younger kids so that The goal is just to kind of give you a functional sense about what's more or less anxiety provoking, so that you know a little bit more, right, about what your child's kind of barriers are and what's more stressful, but it also helps you to pick a good goal. So you want to start with things that are lower on that. So if I have something that's a 1 or a 2, or I have something that's a 3 or a 4, let's say, I want to start with that over something that's going to be a 10, because it's going to be really hard for me to see that it's achievable to get to this 10. But I'm usually pretty willing to start with these things that are 2s, 3s, or 4s. So this kind of yellow category in a stoplight to start kind of being brave. So I will pause now. We have a few minutes left, and I want to make sure that we have a chance to talk about or address any questions that you guys might have. So we thought a little bit about, again, kind of the statistics around mental health, understanding anxiety a little bit more, and kind of when to worry about worry, and then what effective treatment looks like. So I would love to hear a little bit if you guys have any questions or this generated any thoughts for you guys. Looks like we have one question. I appreciate that. So at what age is psychotherapy a more appropriate treatment for anxiety? So if there are different kind of processes that could be effectively explored or worked through. So I would certainly think, so all of the interventions that we talked about are kind of under the broader kind of category of psychotherapy, right? So therapy intervention or kind of psychotherapy is all under this broader category. So whether parents are kind of a little bit more of the agent of change, let's say, so to speak, in the intervention versus kids being kind of the agent of change, that's where you see a shift a little bit developmentally. But I would say that it's always really appropriate to kind of engage in intervention, because you need tools to help kids manage this. And we don't necessarily want to wait to engage in a therapy intervention until kids are old enough to kind of be able to cognitively understand it. Because oftentimes you can kind of like, let's say, like nip it in the bud, right, so to speak. And so if it's not necessarily as complicated and you start to understand some of these skills, right, as a parent, as a child, that we're going to make, you know, kind of a bravery list. So we're going to go through that list. And again, I work with lots of kids in this younger age range. It's just parents are kind of coaching more of that work outside of session. Whereas kids start to kind of transfer kind of some of that responsibility to kids so that they can coach themselves when we know that they're really able to do that. And so that's usually about somewhere between 8 and 10, right, where kids start to develop this ability to kind of think about their own thinking in a way that helps them change it, to where they can say and kind of do the coaching in themselves. So for a younger kid, as a parent, you might say, you know, I know that you can do this. You're really brave. Let's take a deep breath together and let's kind of get into that situation. We know that kids are usually pretty friendly and enjoy playing with you at the park. So let's kind of get in there. So that might be an example of a younger child kind of coaching related to a social experience. As we think about that for an older child, we would want them to really think about how they start to do that on their own, because they might be in those situations in a lot of different ways every day. And we want them to have those tools available to them. So they might say to themselves, I know that, right, I'm more successful if I just stay calm. Kids are more friendly than I think, and I've already been able to make a couple of friends already. So I know that I can do this too. So they start to really kind of coach themselves about that. So that's kind of how I would think about it. And again, that line is somewhere between kind of 8 and 10. But even again, right, some 10-year-olds really benefit from a more behavioral approach. So every case is a little bit different in terms of how you kind of think through, you know, kind of what's more of the cognitive part of that worry, and if that exists, or whether that's more, you know, kind of behavioral. A lot of these parent coaching models are really what I would call big B interventions, like big behaviors. So a related question, it looks like, what would you recommend if your child is on a wait list for CBT and no providers are really available? So I would certainly recommend actually looking at some of those websites that I talked about at the beginning and thinking about, you know, what resources are there. So they're going to also recommend good books and like those types of things where you start to kind of learn and understand that a little bit. And again, the goal is not necessarily, depending on age, right? I don't know, right, your child's particular age, but if I'm thinking about that broadly, for younger kids, you can actually learn a lot of those skills to start kind of coaching some of that as a parent, and understanding kind of CBT and what that process looks like for anxiety can be really, really beneficial. For older kids, you can start that too, right? So knowing and kind of understanding where this intervention's going, you can access a lot of resources that'll help you to figure out how do we start kind of taking some steps there so you don't feel like you're kind of stuck in between. And so I would really rely on some of those resources in the beginning. So effectivechildtherapy.org has lots of good resources to learn about what effective treatment looks like. And Anxiety BC has lots of good resources for parents and kind of toolkits about, you know, what CBT is and how do you coach that and break that down. Great questions. Thank you. All right, so another question. we're talking about kind of this idea of control. So who's in control, the anxiety or your child? Would a child potentially kind of fail on purpose to avoid, right, an anxiety situation? It would depend. I would probably not say that would be very characteristic or typical of most cases. I think that thinking about that for younger kids, I would be really stretched to think that a younger kid probably has that much forethought to kind of plan that particular action. I also think that kids in general want to be more successful versus less successful, but they don't necessarily see the path for how to do that. And so I think it would be pretty unlikely in that situation that they would kind of fail on purpose, because they could kind of avoid it, right, in the future, that they would fail on purpose to avoid that kind of anxiety situation. I think sometimes what happens though, and we know that we start to actually focus on more of the negative situations and more of those failures versus the positive. So anxiety and depression both actually change kind of the lens, so to speak, that we view the world. And as we think about that, some kids might unwittingly actually start to kind of fail or avoid more of these situations because of some of the symptoms, and not necessarily realize that it's kind of like on purpose, but they're paying attention to all of the stress in the situation or how uncomfortable that is, and that they aren't really able to identify many of those successes. And I think that's probably more common. Those are probably more common situations than the child kind of failing intentionally on purpose, right? Sometimes, right, that can certainly happen, but it would not be very common, in my experience at least. Yeah, so a good question, right? I mean, so I think access to care, so this was kind of a follow-up to, what do you do, right, if you're on kind of like a CBT, wait list? And again, I really hate that our access to care just is so challenged. I do feel like the demand of the pandemic has been substantial, that we've had more, and again, it's forced us in some ways that are positive to like have more of these conversations, right? So Pilot, right, was kind of on the cutting edge of that and provided all the support to parents last year, right? So that we were thinking about this at the time that we started to really notice all of those increases in mental health, which is awesome. But we're really working as mental health practitioners to figure out how do we kind of keep up with and manage the demand, because there has been so much additional stress for both kids and parents. I feel like uniquely some parents too. There was an article in the APA monthly journal, American Psychological Association monthly journal for members that was talking about actually this idea of parent burnout and how that's created the pandemic, and kind of COVID has created a little bit of the situation of kind of parent burnout for managing so many of these different situations where kids are kind of so stressed, and that the parenting responsibility has been so great. And so I think parents, right, and obviously, most parents are adults, but I'm thinking about like how much that's created this separate basket too. And it's just unfortunately a situation where it's been really hard, right, to find the resources kind of that you need at the time that you need them. And that's why I think, again, like the National Social Anxiety Center and a lot of those resources that I put out there, is particularly the Social Anxiety Center had a lot of kind of a cutting edge approach about like, let's push all this information out and make it accessible to kids and families, so that you can really go on that website and you can find videos that kind of walk you through a lot of these different scenarios, because we know that also having good education and good resources can really help parents and kids to start this kind of like process of understanding what is this thing that's kind of happening to me, what is anxiety, and what does this treatment look like. And again, as we talked about today, that these principles, I really want them, I have a personal belief that, right, we should make some of this, right, information, it's my responsibility as a psychologist to make this accessible to parents, because it's not necessarily magic, right? That relationship between thoughts and feelings, behaviors, if we all understood that and can think about that in situations, even when we have like, an argument with somebody or something, would all be really helpful concepts. And so again, I want you to know that some of those parent coached interventions can be just as effective. And so seek these resources, look for good information, and reach out to kind of schools, right, pediatricians. They all have lists of providers and or resources for this situation that's going to be really helpful. But I appreciate these questions, and I also appreciate the frustration because I would like that situation to be different. And unfortunately, it's not the reality of kind of where we are at this point in time, that the need is greater. Any other thoughts or questions? No? All right. You guys have been an awesome audience tonight, so I appreciate you guys taking the time out of your busy evening and your busy like parenting responsibilities to engage and learn with us a little bit tonight. So we really appreciate that.
Kami, thank you. I just wanted to hop back on. I took pages and pages and pages of notes for myself. So I hope everyone out there found it as robust and fulfilling as I did. I really, as always, appreciate all of your expertise and guidance on that. And thank you to everyone out there for coming tonight and for asking great questions.
Yeah, thank you guys. I appreciate that.
All right. Well, everyone have a great night. Hopefully catch up on the sleep that was thrown off by daylight savings time.
That's right. It's a little bit of a tough week sometimes, especially for those littles, right? As they work out these new routines. That's very true.
That's the truth. All right. Take care, everyone.